FIND is a global health powerhouse based in Geneva, Switzerland. For over 20 years, it's been developing new laboratory tests for diseases like TB and COVID-19. But now FIND is under scrutiny. Swiss regulators are doing investigations, donors have paused funding, and large numbers of staff have been laid off. And all of this has been kept relatively under wraps for over a year. My name is KJ. I'm a doctor trained in the United States with experience in global health for over 25 years. The smallest problems in rich countries can have massive ripple effects in poor countries. This is one of those stories. Let's dive in. FIND, the Foundation for Innovative New Diagnostics, was launched in 2003. The objective was to speed the development of new laboratory tests for diseases common in low and middle income countries. Now, this is a really important area of work. Patients in these countries have to deal with very weak health systems, and that's not just health centers and hospitals, it's also laboratories. It's very common for patients to tell the story that they walked many hours, very far distances to reach a hospital that was large enough to have a functioning laboratory. FIND's approach was to work on point-of-care testing, something that could be implemented at much lower levels of the healthcare system, like a health center that's closer to the patient. And so this wasn't cheap technology. Sometimes this was actually more advanced scientific technology, but accessible to the patient. That means that patients could be diagnosed more easily, more quickly. It was better for the patient, it was better for the health system, it was better for society. First focus was TB. GeneXpert technology, FIND played a major role in that. And I can tell you from personal experience, it's night and day. The development of the expert test has revolutionized the diagnosis of TB. And there are other diseases too, malaria, viral hepatitis, but the big one was COVID-19. And during that pandemic, FIND co-convened, along with the Global Fund, the diagnostics pillar of the ACT-Accelerator, which was supposed to develop tests for this new disease. And they did. Now, rapid antigen tests, rapid antibody tests, they are widely available. So, to summarize, FIND is a very important organization with a long track record in global health. During the pandemic, budget spiked. After the pandemic, budget normalized, but that set the backdrop for the tensions to come. In January of 2023, there was a passing of the torch. The long-standing chair of the board stepped down, and a new chair of the board was appointed. And the first formal alarms about FIND's management crisis didn't surface until over a year later. Now, let me say that everything we know about FIND is from a single news article published by Swiss Info just a few weeks ago. In May of 2024, there was a slew of anonymous complaints from staff to FIND's ombuds complaining about management. The article gives one example, which was that FIND's travel budget for that year was 433,000 Swiss francs. I mean, that's a huge amount and 5 times larger than any other travel budget in previous years. In July of that year, the Federal Supervisory Authority for Foundations stepped in. So this is the authority that has the regulatory responsibility over all of these very large international and national organizations in Switzerland. They wrote to the board requesting explanation about spending, about staffing, about governance. Between August and September of that year, 4 board members resigned. They wrote a letter to the Federal Supervisory Authority entitled Necessity of Urgent Action to Ensure Fine's Survival. They said that Fine could imminently collapse and that the authority needed to appoint a commissioner to take over the activities of the board. From this period until the beginning of 2024, almost all of Fine's executive leadership were terminated, resigned, or their contracts were not renewed. Swiss Info spoke to some of these ex-employees anonymously who complained of a climate of terror. And it was around this time also that donors started pausing or stopping their funding. This was a financial crisis for the organization. Many of its projects had to be slowed or stopped. And overall, the number of employees went from over 300 to close to 200. Since the end of 2024, there has been very little news about what is going on at Find. In November of 2024, the Federal Supervisory Authority appointed a commissioner of the board, but there hasn't been any change to the board composition, nor any public statement. The Swiss Agency for Development and Cooperation is doing a formal inquiry, including a financial audit of Find, but again, no information about what this audit has shown. Swiss Info was quite clear. They blame the chair of the board. For some reason, they only identify her by some initials for confidentiality reasons, but it's quite clear who the chair of the board is. It hasn't changed since January of 2023. She's been very clear about some of her travel, and Find has said that all of her travel was approved by the board, and she remains chair of the board to this very day. Find has publicly dug in, saying that there were issues related to finance and budgetary contraction that predated the appointment of the new chair of the board, that board members have been replaced, executive leadership has been hired, that things are going well, and the organization is financially sustainable. They contest almost all of the allegations in the Swiss Info article. This isn't the end of the story by any means. We don't really know what went on at Find. We don't know what the current status is. Hopefully, the results of investigations and audits over the next few months will shed some light. But I don't think that this situation has been healthy at all, that everybody is talking about it in Geneva, but very few are willing to be transparent and talk to the press. I understand that global health is very insular. There are just a few major players, and they all know each other very, very well. But in the end, paralysis at Find has massive ripple effects across the entire diagnostics pipeline. It affects manufacturers, it affects funders, it affects national programs, and it affects patients. It's not healthy to hush problems up, and definitely it's not healthy for the patients that we serve. My channel is about global health. I talk about the good things and I talk about the bad things. I hope you like this video and I hope you'll watch some of my other videos. I'll see you next time.